Live. Okay.
See the number of attendees going up. Welcome, everybody. "21 people. Hope you're all having a good afternoon."
Nice and warm. The sun is out. Well, it is where I am anyway.
Same here.
Which is lovely. Okay, we'll just about 1 minute until 2, so we'll just give it another minute and then we'll get started with today's webinar. Okay, so it's just 2 o'clock and we'll start the webinar. So hi to everybody and welcome to our webinar on different ways to voice and communicate after laryngectomy. It's great to have you with us this afternoon, where we'll be taking a closer look at the different methods there are to communicate after surgical removal of the voice box. Now, as the webinar is being recorded, please keep cameras off and microphones muted, and put any questions in the chat or Q&A and they'll be addressed at the end of the webinar. Just to let you know too that the webinar is being recorded and streaming live on Facebook. Next slide, please. Before we get started, we can just go back one, sorry. Before we get started, I just want to inform you that this presentation is a corporate presentation from Atos Medical Group. Nothing in this presentation provides any diagnosis, clinical advice, indication, guide, warranty, or guarantee. Nothing in this presentation can substitute individual advice or guidance from a qualified healthcare professional. You must see your clinician or qualified caregiver for advice on your condition and on products that may be appropriate for you. Next slide, please. So firstly, let me introduce myself. I'm Alison Dempster, a clinical educator here at Atos and a speech and language therapist by background, having worked in the area of laryngectomy for a number of years. Today's presentation will focus on voice and communication after laryngectomy and will also be joined by a special guest. Please pop any questions that you have, as I said, in the chat, and we will answer them at the end of the presentation. Next slide, please. So I'm now delighted to introduce our special guest, Malcolm Babb, who is president of the National Association of Laryngectomy Clubs, or NALC, as you may call it, and had a laryngectomy himself a number of years ago. Welcome, and thank you so much for joining us today, Malcolm. I'll now hand over to you so that you can tell us a bit more about yourself.
Thank you. 20 years ago today, I was having radiotherapy for cancer in the larynx, but after a few months, the cancer was back, and I needed to have a laryngectomy. I'm using an Electrolarynx, but I do have a voice prosthesis. The Electrolarynx works better for me, and I was able to go back to my work as a school teacher for a few years. But in 2007, I took early retirement and started supporting patients locally, meeting them in hospital before their operation And then I got involved with NALC. NALC provides information to over 50 hospitals to use with their patients, but I'll say more about that later. Thanks.
Thanks very much, Malcolm. Thank you. We'll look forward to speaking with you a bit later as well. Next slide, please. Okay, we are going to start with a poll question, if you wouldn't mind responding to it. And that question is, how long ago did you have your laryngectomy? So we have a range of different people joining us today who've had different experiences depending on where and when they've had their surgery. And so they're likely to use different methods of communication, which we can then discuss in more detail. So if you wouldn't mind just clicking on the response that applies to you on the poll questions. Are the poll questions about to come up on the screen? There we go. Yeah. So how long ago did you have your surgery? So the options are less than a year, between 2 and 4 years, or more than 5 years. Okay. So it looks, whoops, changing. Okay. So it looks like the majority of people that are joining us today had their surgery between 2 and 4 years ago. Okay, so thank you for filling in that poll and letting us know when you had your surgery. Thank you. Okay, next slide, please. So now we're going to have a closer look at speaking and communicating after laryngectomy. Next slide, please. So because a laryngectomy involves the removal of the larynx, or some people may call it the voice box or vocal cords, the way a person speaks will change. So after laryngectomy, the natural voice created by the vocal cords is completely lost, and a person's voice will sound different after a laryngectomy because the voice is no longer being made by the vocal cords. However, people can learn to use a different voice using a different method, and your speech and language therapist will be able to help you achieve a voice suitable for you, and will give you exercises that will make your new voice as good as it can be. Next slide, please. So now we have another poll question, if you wouldn't mind just taking a minute to click on the screen. So this is about what method you use to voice or communicate. So do you use a voice prosthesis, an electrolarynx, esophageal speech, pen and paper, text-to-speech, or something else? So if you wouldn't mind just clicking on the response that applies to you once again. Great. Okay, so I'm just waiting on the last responses. Okay, so we can see that the number of people that use a voice prosthesis is at 65%, then electrolarynx at 23%, esophageal speech 3%, pen and paper 6%, text-to-speech, nobody uses that, and then other is 3%. So quite interesting that now most people do use a voice prosthesis as their main method of communication after laryngectomy. Okay. So if we can move on to the next slide, please. We're going to have a look at the different types of voicing after laryngectomy. Okay, so the first method that some people use and that some people have indicated is esophageal speech. So if we can move on to the next slide. Esophageal speech is something that used to be taught quite routinely after laryngectomy before voice prosthesis were so widely used. This is the oldest speech technique, which not everybody can master because it is a bit tricky to learn. Also, often esophageal speech is limited to quite short phrases at a time. This type of speech involves passing air into the esophagus before moving it back up out of the esophagus into the mouth. So there is a limit to the amount of air that can be used when doing this restricting it to short phrases. So tissues in the throat vibrate, creating a sound source, which acts as the new voice. Although it can be difficult to learn, though, some people can actually use this method really, really well and use it very effectively as their method of communication. Next slide, please. We're now going to consider the method that most people use that are on the webinar today, and that is speaking using a voice prosthesis. So next slide, please. So this is the most common type of voice these days after laryngectomy and is made by speaking with a voice prosthesis, which many of you have indicated that you use. This is a small silicone device that's placed in an opening made between the windpipe at the back of the stoma and the food pipe. And when the air coming out of the stoma is blocked by a finger or by gently pressing on a heat moisture exchanger, that air travels through the voice prosthesis, up through the food pipe and up into the mouth. And as the air travels up through the food pipe, it causes the tissues to vibrate and creates a sound, which is the new voice. This method of voicing can be very effective and is thought to sound most like a voice before laryngectomy. Next slide, please. So there are certain things you can do if you have a voice prosthesis to really make your voice the best it can be. So this includes trying to sit in an up.
We lost Alison, haven't we? Yes. So let's wait. Just give a few seconds, see if Alison comes back. If not, I can carry on. I think she was saying that the 5 top tips for a better voice when using your voice prosthesis is to try to maintain an upright posture when speaking. So shoulders down, big chest, take a deep breath in. So and number 2 says relax your neck and lower your shoulders to ease the tension in the muscles, so the voice isn't as strained. So if you imagine that you're like this, very tense, trying to speak is probably not going to have as good as a result as if your shoulders are down, your neck is relaxed, and you're taking a deep breath from your stomach. Welcome back, Alison. I'm just jumping in.
Thanks, Daniela. I'm so sorry. I've been having some problems with my internet connection this week. So I'm really sorry, but the positive point is I'm able to get back on quite quickly. So if I lose my connection, it will only be a few seconds until
we
I'm
continue to play ping pong between the both of us.
Yeah. Okay, thanks, Daniela. So I was just saying that keeping your head and neck and shoulders as relaxed as possible will help all the muscles that make your voice nice and relaxed as well, so that your voice isn't strained. If you find that you're straining your voice, this can reduce the voice quality that you're going to achieve. And using diaphragmatic breathing instead of chest breathing will help you to keep you nice and relaxed and give a good air supply for you to move through the voice prosthesis and up through the food pipe. When pressing on an HME to occlude the stoma, the pressure shouldn't be too hard or too soft, but should just be enough to prevent any air escaping from the stoma. You should practice occluding the stoma every day so that you can get used to the amount of pressure needed, but that's still comfortable and so that no air escapes from the stoma. You should also press your HME in the middle to ensure good occlusion of the whole HME and not just one bit of it or one side of it. Okay, next slide, please. So we're going to think about some tips now to prevent your voice prosthesis from becoming blocked and affecting your voice. So firstly, you should drink plenty of fluids, especially after you've eaten, to make sure that any bits of food or mucus that get washed down don't block the voice prosthesis. If the voice prosthesis gets blocked, the air won't be able to get through and the voice will deteriorate or it could even disappear. Make sure you clean your voice prosthesis after every meal, again, to make sure it stays clear of bits of food. Also keep an eye out for any liquid leaking through the voice prosthesis, as this will affect the airflow through the device and maybe a sign that the voice prosthesis needs changed. And when a voice prosthesis needs changed, the voice can deteriorate. Okay, next slide, please. So I already mentioned that to make a voice with a voice prosthesis, the air needs to be blocked from coming out of the stoma on the outward breath so that it is diverted through the voice prosthesis and up through the esophagus to make the sound. So the blocking of the stoma can be done using a finger or by pushing down gently on the HME. So here we have a picture of the HMEs in our new Provox Life range. They're very easy to push down on to occlude the stoma, and they actually have an indentation in the middle to guide you as to where your finger should go. So these new superior HMEs give the correct level of humidification and breathability for all the situations that you could be in. For example, there's one if you're relaxing at home, one if you're a bit more active, such as going for a walk, one if you're doing more vigorous exercise, so that might be running or cycling. There's one if you want extra protection against viruses and bacteria, one for use overnight as you sleep, and there's also an HME if you speak freehand. So every one of these HMEs can be used with any of the Provox Life adhesives, buttons, or Lary tubes. They will reduce the amount of mucus production and coughing that you experience, and this will be beneficial not just for your chest, but also for your voice. Some people who use these HMEs have told us that they think their voice quality is better. So you can work with your clinician to identify which of these HMEs may be suitable for you and to achieve the right pressure, including the HME, to really optimize your voice quality. Next slide, please. So the Freehands Flexi Voice, which some of you may use, is a device that can be attached to the Provox Life Freehands HME. And this will allow you to speak without having to occlude your stoma with a finger or press down in the HME. It means that you can do activities such as driving or cooking without having to use your hands to occlude your stoma. The inbuilt HME reduces mucus production and coughing, and this is very beneficial to your voice as it will minimise the amount of mucus potentially getting into and blocking your voice prosthesis. So the Flexi Voice can be easily removed from the HME without even using a removal aid. And both the Freehands Flexi Voice and HME can be used with any of the Provox Life adhesives. Okay, so next slide, please. So I know that many people currently use or have used in the past the Electrolarynx to voice after laryngectomy. So let's take a closer look at that. Some people do use the Electrolarynx as their main method of communicating and can achieve very effective and clear voice. Other people who use a voice prosthesis as their main method of communication may also have an Electrolarynx, which they use as a backup. For example, if their voice prosthesis needs changed and their voice might not be so good. So this device produces a voice which sounds electronic, obviously a very different sounding voice compared to esophageal voice or voice prosthesis voice. However, Electrolarynx speech is often what people prefer, and it's a great option straight after surgery before people have been taught to use a voice prosthesis while there may be healing taking place. So the Electrolarynx creates a vibrating sound, and this sound travels through the body's tissues, often the neck tissue, and up into the mouth. And the sound is shaped by the tongue and lips and teeth to create understandable speech. And we've had a perfect demonstration of a really effective Electrolarynx speech from our guest Malcolm today. So that's been great to hear that, Malcolm. Next slide, please. So just some tips that you might be interested in that can help you when you're speaking with an Electrolarynx. So you should always try to make sure that there's full contact between the flat head of the device and your skin when you're voicing. Any movement, for example, turning your head, that will make a bit of the device lose complete contact with the skin can result in deterioration in the voice. You should place the device somewhere that the skin's soft and thin as opposed to placing it on thicker, harder tissue. Speaking more slowly can make your speech clearer, as can over-exaggerating the sounds and words. Remember to pause when you're speaking and consider using sentences that are slightly shorter just to maximise the clarity of your speech and make it sound more natural. And finally, as facial or neck hair can interfere with the contact and sound transmission of the device, you may wish to consider keeping yourself clean shaven as well. Okay, next slide, please. So I just wanted to speak briefly about this device called the True Tone Emote. I don't know if any of you know this product or use it even. but it's a high quality electrolarynx to allow you to express yourself more naturally. And the thing that makes it different to other electrolarynxes is that it has a pitch variation function, meaning that your voice can have different pitches and intonation patterns, allowing your emotions to be expressed more like your voice before surgery, because our intonation changes depending on what we're saying and depending on what emphasis we want to put on words. So this device is simple to use when you know how, of course, and also allows you to change the volume of your voice from a whisper to a loud voice if you want. So it's also comfortable to hold. It's really sleek and comfortable with that hourglass shape as well. So really nice to hold it in your hand. Next slide, please. Okay, I now want to hand over to Malcolm again, because I know that Malcolm, as he said, uses both the electrolarynx and also has a voice prosthesis. And I wondered, Malcolm, if you could explain a little bit more about that and share any tips that you have for either of these voicing methods. So over to you, Malcolm.
Thank you, Alison. You have given some tips already, but I'll add to them. There are, I think, a couple of key issues. Firstly, placement. People talk about the sweet spot when using an electrolarynx. I am fortunate that after my surgery, it's very easy for me to find the sweet spot if I move the electrolarynx to a different place. And now I'm on the spot that works best for me. So that's the first task if you're starting to use an electrolarynx. I'm afraid some people won't be able to find a sweet spot, and it all depends on the tissue under your chin. If someone's got lots of lymphedema, for example, then the vibrations from the electrolarynx just will not be able to get through. As I said, I've got no such problems, so it works very well for me. There are a couple of alternatives, and one of them is to use this oral adapter. It fits over the end of the electrolarynx, and then you place the mouthpiece inside your mouth. I'm going to demonstrate it. I offer no guarantees for how well it will sound to you. I've known people who place the electrolarynx on their cheek, again because they can't get a signal with it under the chin. So all is not lost if you can't find a sweet spot under your chin. One of the comments that's often made about speech with an electrolarynx is that it is robotic. You use a text-to-speech app. The words come out at a regular pace, and it's most unnatural. When we speak with our original voices, we use a lot of intonation and emphasis. You can do that using the electrolarynx, so try not to just speak in a regular fashion. You can still put emphasis on the key words you want to get across. I have a very loud speech using an electrolarynx, but some people using an electrolarynx don't manage to get so much volume. In those cases, it's important not to keep your finger on the button all the time, but to take it off between words or between phrases. Otherwise, there's a risk I'm taking my hand on and off the button, and it reduces the droning sound that can be heard at times. As I say, that's particularly helpful if you are not loud in the speech that you produce. I have known people who are very resistant to using an electrolarynx, especially in public. I mentioned that I went back to my job as a school teacher, and I can say honestly that the reaction I got from the students to my speech was 99% positive. If I'm out in public and I start to speak with my electrolarynx, particularly because I'm quite loud, I have noticed people do look at you, but mostly it's out of interest, and I always, particularly these children, either they're staring at watching me and watching me speak. I always try to explain, and people are very, very supportive. A large proportion of the audience this afternoon uses voice prosthesis, but many valve speakers during the course of their time using them will have problems. They may need some granulation removed. They may have to have a spell where they can't use their valve. So knowing how to use the electrolarynx can be very, very helpful. I hope that helps, Alison.
Yeah, absolutely, Malcolm. That is really, really useful advice for everybody. I wonder if I can ask a question about which hand you choose to hold the electrolarynx in, because some people choose to hold it in their dominant hand. Some people choose to hold it in their non-dominant hand so that they can, you know, still use their dominant hand to write in things if required. So which hand do you hold your device in?
Right-handed, and I hold the electrolarynx in my right hand. There are a few times when, say, you're on the telephone and you've got the telephone in one hand, you've got your electrolarynx in the other. If you need to write, I just explain, right, I'm going to write this down, but I can't talk while I'm writing. I have on occasions used my left hand, but I'm more comfortable using my dominant hand.
Okay, great. And do you have any tips for using the telephone? Is there any advice you can give about how to make your voice clear over the telephone, or any particular advice that you would give people?
I certainly get some help from somebody to get things set up correct. For example, what volume works best. To get a friend or a family member on the telephone and use them as a guinea pig to see how things work. And it may even be worth experimenting with different pitches. Now, you mentioned the true toning mode where you can vary the pitch. Other electrolarynxes, the servo, for example, has got 2 buttons, so you can have them at different pitches. So that might be worth investigating.
Yeah, because I know that sometimes higher pitches can be a bit distorted on the phone, and higher volumes as well. So like you say, it's a case of calling somebody and sort of experimenting with the volume and the bass pitch, just to find out which is clearest. Yeah. And if, for example, somebody uses an electrolarynx holding it in the right side of their neck, should they hold the phone on the left, in their left hand, to increase the distance between the two, do you think?
I'm not sure. I have to say that I'm not giving people the people I speak to, any choice. I hold it in a way that suits me.
Sure. Okay, so that could be something for people to experiment with when they're speaking to somebody over the phone, just holding it in different.
And also having it on speakerphone. I find that works, and that works fine.
Okay, that's a good tip as well. Yeah, great. And how long did it take you? You're obviously very proficient in your use of the electrolarynx. How long did it take you to become so skilled in using it, Malcolm?
Well, I had my puncture for the valve done at the same time as the laryngectomy, and about a week after the surgery, my consultant came and put the valve in, and he expected me to be able to speak with the valve at once, which most disappointed when I couldn't. But in fact, an electrolarynx doesn't work too well for a couple of weeks, not unless you use the oral adapter, and that's because I got swelling and it made it more difficult. So when I first used an electrolarynx, I was very, very quiet. But as the swelling reduced and it got louder and more useful, and I carried it about. After a couple of weeks, I was using it and carrying it about with me all the times.
That's great, and really useful for people to know that in these early days after surgery, because of the extent of swelling, like you described, it maybe won't happen instantly, but after things have settled down, then the chances are that people will see an improvement in the sound quality.
I used a text-to-speech device quite a lot for the first couple of weeks, and even carried out telephone calls that way, because I couldn't get a loud voice any other way.
Yeah. And Malcolm, I know that you have said that you've got a voice prosthesis. Which situations do you like to use the voice prosthesis in, over and above the electrolarynx?
I only used the backup. There was a very famous member of the American group Web Whispers, which has been supporting laryngectomies for decades, and she wrote a book called I Left My Voice on the Dining Room Table. In other words, you've gone out and you left your electrolarynx at home. So for me, I use my valve when the battery runs out, or I do forget to take my electrolarynx with me. I use it as a backup. When I use my valve, I use a very big pressure. I was offered Botox treatment to try and solve that, but I didn't bother with it. So I can't. If I talk for a long time, there are problems with the seal of the base plate. So it's for me, it's a backup.
Yeah. Okay, that's really useful to know. Thank you for sharing your experience with us, Malcolm. We'll come back to you, I know, later on in the webinar. Thank you very much. So we can just move on back onto the slides, please. Okay. After laryngectomy, if you do use a voice prosthesis, improving your breathing method can really help improve the sound of your voice. So you may have heard of the breathing method called abdominal breathing or deep central breathing. And this type of breathing can cause your body to feel more relaxed and can also provide more breath support or air for you to divert through the voice prosthesis when you speak. This type of breathing can therefore make your speech louder and stronger and clearer. So with diaphragmatic breathing, when you breathe in, your abdomen or stomach should move outwards as the lungs expand as they're filled with air. So it's a bit like balloons being filled with air and they expand. When you breathe out, so when you speak, your stomach or abdomen will flatten again because the lungs are emptying, just like balloons emptying. So for more information on this breathing technique and more exercises, you can visit the MyLife app. Now, these exercises can be done anywhere and really have a positive influence on your voice. And the app contains lots of useful information and advice to help you and your family. It's been designed in close collaboration with patients and clinicians to provide all the relevant information to help you overcome the challenges and live life as fully as possible after laryngectomy. Now, there's a series of exercises to help you improve your voice that you can practice at your own convenience. One MyLife app user has actually said, when referring to the app, highly informative, especially in the initial phase, and very motivating due to the learning objectives. So on the app, it tells you what the aim of the exercises are, so you're fully informed about why you're doing certain exercises. Okay, so moving on to the next slide, please. Because I just wanted to say that in case you weren't aware, Atos offers a range of expert services to support people fully after laryngectomy. We have a dedicated customer care team who can provide information on various aspects of laryngectomy if this is something you would like. We have a specialist team of nurses who can visit you in your home, should you and your clinician wish. And we also hold a regular MyLife experience programs, giving you the opportunity to get together with others and discuss and participate in a range of very useful topics. Our next experience is actually on Wednesday, the 29th of September, and it's all about practicing your voice and optimizing your voice. And you can sign up for this using the website address on the screen. Okay, next slide, please. So I'm going to hand back to Malcolm again, and this time he is going to talk about something called the audio logo. So over to you, Malcolm.
I don't know if you in the audience mind using the telephone. I've certainly occasionally had problems. For example, when I pick up the phone to answer, sometimes when the person on the other end is speech, they put the phone down. Also, I did the other way, that when I ring someone up, they've heard me speak, and again, they put the phone down. So, using the telephone can be a problem for people like laryngectomies with communication difficulties. NALC is joined the audio logo project. Next slide, please. The aim is to try to find a solution that alerts people to the fact that they're speaking to someone with communication difficulties and they don't stop the conversation for that reason because it sounds strange. The idea is to use something called an audio logo. Next slide, please. This is an example of an audio logo. Could we play it, please? That's the audio logo that the company Intel uses in its adverts. The idea being that if you hear that sound, you know it's Intel. Now, Professor Pamela Enderby of the University of Sheffield is leading the project, and the aim is to have available, when someone rings the telephone of someone with communication difficulties, they hear an audio logo and that alerts them to the fact they're speaking to someone who may have problems. So far, Professor Enderby has been in extensive discussions with telephone companies and with various charities who work with people with communication difficulties like NALC. And it will require a widespread campaign to get it to work, but the aim is to get it adopted across the country and indeed even to get this adopted internationally so that all around the world that someone rings, someone using a telephone, they hear this logo. If the person has got a problem with communication and speech, it's in its early days, but I'm sure you will hear something about that before too long. Next slide, please. As has been mentioned, I'm involved with the National Association of Laryngectomy Clubs. We've been around since 1975, and I would just like to highlight 2 resources that you may not have seen. We have a website. On that website, all sorts of information materials can be found and they can be downloaded. As well as that, we have a newsletter and that can be downloaded. We also have a YouTube channel. On there are about a dozen videos on various topics. For example, suppose your valve leaks and you decide you need to do something before you can actually get into the hospital to get the problem sorted out. There's a video that explains how to use a valve plug. Could we just go back to the previous slide, please? So the second link there is for the YouTube channel. NALC will get you to the website and you can get to the YouTube channel that way as well. So I just wanted to make sure everybody was aware of these resources for laryngectomies. Thank you.
Great, thank you, Malcolm. And it really can be of tremendous help to people just to be able to access these resources. So thank you. Can I just ask a question about the audio logo, which you're hoping to roll out? What kind of time frame are you thinking for that? How long do you think it's going to be until that is used in this country?
Yeah, like everything else, the timetable has been pushed back by COVID. So it may not be until next year that things really start to happen. But all we are doing, what Alison Dempster, the charity will be doing, we're getting ready to start publicising it, as are all the other charities that are involved.
It really is a great way just to make sure that people are heard and people that do have communication problems are not just hung up on, like you say. So good luck with that, and I'll look forward to hearing more about that as it unfolds. Thank you so much, Malcolm, for being here today. I'm sure everyone would agree that having you has been so informative and helpful, and we're so grateful to you for your time and for sharing your knowledge and your story with us. I think we now have some questions that have been put into the chat, Daniela. Is that right? Are there any questions that anybody wanted to ask?
Yes, we have some questions we can get started with, but if anyone else here today has got any more questions, please use the chat function on Zoom and just write them down, and I'll be posing them to Malcolm and Alison today. So that's a great initiative. I have to agree with Alison, the audio logo. And actually, one of the questions we've got here is, do Siri or voice recognition software work if you're an Electrolarynx user? So Malcolm, what is your experience using Siri, Alexa, etc.?
I have, like all of us, I am sure I've encountered voice recognition systems. When I ring my bank, they ask me to speak, and I've not yet found a voice recognition system that works with my speech. So I answer or say what I'm supposed to say, but their machine cannot understand me. Fortunately, in most cases, you stay silent for long enough, you will be given an option to import a choice via a keyboard. So don't panic if you're using Electrolarynx and you understand. Usually they will have a manual that will work and you'll be able to use a keypad instead.
Yeah, can imagine the frustration. I've spoken to a few people who have had issues trying to, you know, get through to their in energy company to pay for a car parking, etc., etc. It's I can imagine. Well, I've been there with other people, and I can see the frustration when you come across these sort of softwares.
One problem on the telephone that I didn't mention is that there are some sounds, consonants, particularly ancient, that I can't say. And I can remember once I was changing my car and I got given my insurance company the registration number of the car, and I did. And then when the certificate arrived, the registration number was wrong. So I always have in front of me a copy of the NATO alphabet, and for key bits of information, I spell it out in detail using the NATO alphabet.
Yeah, that's a good idea, actually. And to be honest with you, that has happened to me. It wasn't because of a certificate, but it's happened to me where I've got the text confirming the car park with the wrong registration number. So it can happen to anybody. You haven't got to speak with an Electrolarynx, but I can see that would be a lot more difficult. Thank you. Thanks for that, Malcolm. I've got.
Sorry, could I just ask, just continuing on from that, Malcolm, how do you find your telephone voice with your voice prosthesis speech or Siri response to voice prosthesis speech?
I found the mouth speech will work for me over the telephone, but the problem that I just mentioned about sounds applies across the board, whatever method of speech you're using. There is some sounds that you can't make because of the surgery.
Yeah. Okay, thank you.
Okay, so going on to the next question, and maybe I can direct this one to you, Alison. It's a bit more about the appliances to be used when speaking, and the question reads, why is air escaping from my HME when I'm speaking? So I'm guessing this is for someone who would use a voice prosthesis. Yeah,
so if you use a voice prosthesis and you have an HME, if it's attached to, for example, a base plate, or an adhesive, you might call it, it's important that when you occlude the HME that you press it down fully. And now that doesn't mean necessarily pushing really hard so that it's uncomfortable, but it's important to prevent any air leak out the sides of the HME so that all the air is diverted through the voice prosthesis and up into the esophagus to cause the muscles to vibrate, which create the voice. So it's important to just practice, as I touched on earlier, applying the right amount of pressure to your HME so that you're able to prevent any air leakage without overpressing, because if you start to overpress, it can push the muscles together in the neck, and that the voice can deteriorate. It's also important to push it in the middle, because we want all of the foam to be pressed down, because inside the HME it's springy foam, and we want all that foam to be pushed down on a level way, all of the foam, the full foam, and not just one side of it. If you press down on one side of it, you will get air leak from the other side. So it's important all the foam is pressed down. It also depends as well on whether you have any air coming from under an adhesive or a base plate. Sometimes if the seal is broken, the air will leak and the voice can deteriorate as well. Does that answer that?
Yeah. Someone just commented on the chat saying sometimes the self-adhesive base plate might be leaking air. That's exactly what you just said.
Absolutely.
Yeah, so it's important to get that seal before trying to speak.
Absolutely. It's about ensuring you can get the best seal possible, because the best seal of an adhesive will give you the best voice, because it'll be less likely to blow off. As soon as it blows off and air comes out, the voice will deteriorate or even be lost. Now, there's certain things you can do to make sure that your adhesive is you're achieving the best seal that you can as well. So we can also offer some tips on that if anybody wants that.
Thank you, Alison. Another question we've got is, can I get some views on Electrolarynx brands? I've heard many names: True Tone, Solitone. I think, Malcolm, you mentioned Ceravox as well. Any comments appreciated? So I'm guessing this is someone trying to get a better feel for what's the main differences between different electrolarynxes. I don't know, Malcolm, have you used always the same one? Have you tried different ones?
I used the Solitone, which it comes from the same manufacturers as the True Tone. I used the Ceravox, and at the moment I'm using a Lonsinger Electrolarynx. For me, the power supply is in Kyushu, and many hospitals used to give out a Ceravox to their patients, and they got specialist mattress. But nowadays, that's changed. If you have a battery to put it in it, then it would be a rechargeable battery, and you could, if you could go into a shop and buy one just to put it to keep you going. Also, some of the latest models have an internal battery. So that's slightly different. You charge it in the way you might charge a mobile phone. The easier it is to keep it working and keeping the power supply there, that's a key factor. In my experience, you get what you pay for, and if you are going to use an Electrolarynx all the time, then it's worth having a good one. And the True Tone, for example, you may not want to use all its features. That's up to you. The one I'm using at the moment is cheap and cheerful.
Thank you. I think that will depend on what people value, isn't it? I mean, if you, if people want to have one that they don't have to worry about charging as much, or if they want one with the different tones and volumes with the pressure of that finger, it depends on what they can use and what they can afford, I suppose, as well, and what what's easier for each person. So yeah, I think it's good that you got to try a few. Yeah, I mean, if there are any sorry, carry on, Malcolm.
There can be problems using an Electrolarynx supplied by an hospital, but it may be second hand. And without wanting to upset any speech and language therapists present, they are not the best at adjusting, getting things set up mechanically, and often patients are left with the job of getting it working to their needs best. So people end up buying an Electrolarynx for themselves, one that suits them and that works well.
Yeah, I've heard as well about local charities in different parts of the country that will support patients to get an Electrolarynx. So maybe it's worth asking around and finding if there is anyone that can help if obviously they don't want to pay for them.
Can I mention that another initiative that NALC's on with at the moment in Scotland there is a piece of legislation that recognises the importance of the voice to the person, and there's a piece of legislation that says that people with communication difficulties must be provided with the necessary devices and support. So someone living in Scotland who has motor neuron disease can get have a recording, you can bank their voice for use later in a text-to-speech device at no cost. In England, you have to pay it, or you get a charity.
Yeah.
We're trying to get the legislation adopted in England so that people with communication difficulties are supported as well as they are in Scotland.
Yeah, that would be amazing. That would be such a big step, wouldn't it? Okay, have you got anything to add, Alison?
No, I wasn't aware, being from Scotland myself, I wasn't aware that that was the case in Scotland. That's really, really useful to know that. Yeah, good on Scotland for doing that, and hopefully that will roll out south of the border. Yeah, great.
Okay, so we received another question that reads, now I'm learning how to speak with my voice prosthesis. Is there a particular HME better for speaking? So maybe Alison, do you want to answer this one?
In terms of the way your speech will sound using a particular HME, not really. The important things are that you have a good seal for the attachment. So whatever the HME is sitting in, whether it's a base plate or a tube or a button, and that you occlude it sort of the way that it's supposed to be occluded to get optimal speech and to reduce any air leak from the HME. I would say that's the key thing really. The HMEs, as I said earlier, they work by sort of occluding and pushing down on them, and that blocks the air, so it's pushed through the valve. So as long as you've got a good method of occluding that, and you can work with your clinician to get the best pressure and position, etc. For that, that should be good enough.
Thank you, Alison. There's someone who's commented in the chat that says, Rosamund, who says, my esophagus was removed and I have a stomach pull-up, but my voice is pretty good considering with the prosthesis. That's really, really good to hear. And I'm glad you're getting on well, Rosamund. So going on to the next question, which is, how long after having a voice prosthesis fitted can you speak? Maybe Alison, you can take that one again.
Yeah, sure. It depends really when you have your voice prosthesis fitted. Some people will have their voice prosthesis fitted at the time of the laryngectomy. So when they're having the surgery to remove the voice box, the prosthesis will be fitted at that time. The puncture will be made and the prosthesis fitted. So for these people, usually between 10 and 14 days after the surgery, speech therapists will come see you on the ward and will start to think about producing a voice and start to explain to you all the things to do to achieve your new voice. If you don't have your voice prosthesis inserted at the time of your operation, if you have it inserted some months later, which some people do, as soon as the voice prosthesis is in place and everything has settled down, it can start within a day or two. So it just really, the key is when it's placed. Is it at the time of surgery or after? Because if it's placed at the time of surgery, we just need to wait until everything's healed up before starting to use these new muscles and tissues.
Brilliant.
I didn't start to use my valve until I could have a base plate fitted, which makes vowel speech so much easier. But as you said, immediately after the operation, fitting a base plate may not be possible.
Yeah, that's Very good input. Thank you both. There's a question in our Q&A that says, it's a very interesting one. Nori says, I miss laughing. Is there a way or a technique to practice to laugh? Maybe this is an interesting one for you, Malcolm. What do you think? Do you also miss laughing? And is there something that you do to, let people know that you found something funny?
Yes. The other functions as well that I still miss, things that you can't do, and people don't realise you can't do them either. You rely on the people around you to recognise what you're going through and supporting you, getting used to the situation you're in, and hopefully there will be people who will be sympathetic to, shall we say, our moans. I remember certainly in the first few months there were times when I got angry about the new situation and not being able to do things that 20 years down the line I'm fully adjusted now.
Yeah, I think from having dealt with many people post laryngectomy, from the other side, you can kind of tell when someone's laughing, even though there is no sound. But I can imagine it's something that you lose, and obviously that you will miss. Okay, so there's another question here from Frank. And it says, hello, I had my op in August 2018. Since then, my voice has been a whisper. People have said that it is my voice. Problem is, whilst taking a sudden block of the whisper, I take a sip of water and resume for only a couple of words. Not sure what the question is there. I think there's some sort of difficulty in continuing to speak after taking a sip of water. And then the second part of the question reads, how does one get the true tone emote? So maybe the first part of the question for you, Malcolm, and then the second one about the true tone emote for you, Alison.
Sorry, I was, could you repeat the bit?
Yeah. So Frank says he had his op in August 2018, and since then his voice has been a whisper. People have said that it is his voice. The problem is, whilst talking, the sudden block of the whisper when he takes a sip of water and can only resume for a couple of words. If you've got any tips on, talking and having a sudden block, or when you have a sip of water, if you have any issues when you use your voice prosthesis, of course.
I think there's a great variation between laryngectomies in their experiences around that matter. There are some things that I drink and I can't use the mouth. Very strange. I don't know exactly how everything works in that way. If I was struggling with if the mouth speech was unreliable, then I'd be wanting to have an electrolarynx, so that because there are times when you need to say something and be in a position to be heard, and have a second method of speech for when things are problematic.
Yeah, I think that's where the second part of the question comes in, which is how does one get the true tone emote? Alison, have you got some suggestions on how to access one?
Yeah, I mean, often hospitals will have a stock of them. Speech and language therapy departments usually will be able to give you one to try, or give you a loan of one to see how you go on with it. That's really the first protocol, I would say. Just speaking to your speech and language therapist, finding out if she has one that she can provide on a loan. Obviously, our company we provide these devices as well. And if you wanted to speak to anybody about one of these, you could contact customer care on one of the contact details on that were up on the screen earlier. That's something you could do to get some more information. But I would say as a first protocol, speak to your speech and language therapist.
Yeah.
Ask me for recommendations about an electrolarynx. I'm giving people all the information, and I myself have purchased on other people's behalf Electrolarynx from all of the companies. But I think the point that Alison made, before you do anything, try one on loan, because there's no point in parting with any money if it's not going to solve your problem.
Of course, yeah, it makes sense. Well, I didn't realize the time is 3 minutes past 3 already, but we have one last question, and perhaps I'll direct this one to you, Alison, and it reads from Raphael, and it reads, does a larger valve help produce a louder voice?
Well, in answer to that question, it can. It can. As you said, Malcolm, earlier, it's voice after laryngectomy is very, very individual. What works for one person may not work for another. People have different voices, loudness levels, pitches in the voice. But certain prostheses that are larger will obviously allow more air to travel through them. So that is more air to vibrate those essential muscles that are making the voice. So it'd definitely be worth speaking to your clinician about that if you feel that your voice isn't quite as loud as you would like it to be. Yeah, all I will say is that a larger diameter prosthesis can make, for some people, the voice louder. And different types, there's different types of prosthesis as well. So the best thing again would be to speak to your clinician and just take it from there and see what advice your clinician gives you.
Brilliant, thank you. And with that, I think we can finish our webinar. Just to remind you that there will be a survey at the end. So when you leave this session, there will be a few questions asking about your feedback about the session today. And we would be very grateful if you can answer. It will help us to continue to produce content that is relevant to you and to know what do you do or what you do value when you attend these webinars. So thank you so much for joining us. Thank you to Malcolm for coming in and sharing your experiences and your very valuable input. It was great to hear about the Audio Logo initiative as well. I hope to hear about it in the near future. And thank you to Alison for coming to share your expertise and your experience as a speech therapist, but also as a clinical educator and with Atos. So I wish you all a very good afternoon, and we hope to see you very soon. Take care, everybody, and stay safe.
Thanks. Bye, everyone.
Bye.
Yes.